purpose of this study was to explore the severity of substance abuse and reason for using drugs among prostitution African American women who smoke crack cocaine. Specifically, we are interested in examining whether prostitutes use drugs as a means of coping with intra- and interpersonal experiences commonly associated with their occupation. Now I would like to describe the method using a convenient sample of 203 African American women with a history of crack cocaine. Participants were interviewed and asked a variety of questions, including whether they ever engaged in participation as a source of income and the severity of and reason for the drug use. Research showed that women who were prostituted, in contrast to those who were not, were found to have a significant higher severity of drug use and were significantly more likely to use drugs to increase confidence, control, and closeness to others and to decrease feeling of guilt and sexual distress. The researchers argued that women may enter prostitution in order to find their drug use. However, prostitutes likely increase their drug use in order to deal with distress caused by activities associated with their occupation. Finally, the writer discussed the mental health issues which need to be addressed by the government. Introduction. The researcher mentioned several studies of the use of drugs to cope with prostitution, but they primarily focus on drug abuse other than crack cocaine. And in this study, there is more emphasis on the relation between crack cocaine and prostitution. It has found the work condition of prostitutes who use crack cocaine may be particularly stressful, suggesting that this population may be especially likely to use drugs to cope with the stress associated with prostitution. In addition, the prostitutes who use crack cocaine were more likely to come from very poor background rather than other prostitutes. As mentioned, the participants were Afro-American with a history of crack smoking, and they were compared to African American women who are not prostituted. Table 1. The figures indicate that in both groups the education was mostly low. However, in the population of prostituting, the percent of low education was higher about employment in both groups. Most of them were unemployment. The majority have low income. Another aspect is that most of them have a single status. Nearly all of them have children. There is not much difference in the number of drug use and the age of first drug use. In addition, Table 1 shows that most come from low socio-economic background. The result of the research indicate that the first hypothesis was that women using crack cocaine were prostituting would be more severely educated to substance than women using crack cocaine were not prostituting. The findings clearly shown in table discussion. The researchers claim that this study indicates that severity of substance addiction and explanation for substance use are related to prostitution in a sample of African American women who smoke crack cocaine. The writers also point out it's difficult to determine causality between drug dependence and prostitution. Moreover, it is likely that prostitution and drug use is a self-perpetuating cycle in which the engagement in one leads to an increase in the other. Although women may start working as prostitutes in order to finance their drug habit, there are a number of aspects of prostitutes that often cause psychological distress and trauma, which in turn may lead to increased drug use as a means of coping. Also, the findings support previous research on prostitution and drug use among women who are using heroin and alcohol regarding the severity of addiction and reported reason for drug use. Finding that the women in our sample who were prostitution were more likely to use drugs to come with interpersonal experiences is not surprising in light of what is known about the attributes of their occupation. Also, the women in the sample who were prostituting were also more likely to use drugs to decrease their feeling of guilt and sexual distress than the women who were not prostituting. Research also suggests that this feeling of stigmatization may lead women who are prostitution to feel guilty about their occupation and to turn to drug as a means of escaping guilty feeling. Despite the limitation of the research, they were able to show that hypothesis was correct. In conclusion, the researchers recommend that further research is needed to advance knowledge about the lives of prostitutes and the negative consequences of prostitution, is needed to assist healthcare providers and policymakers in understanding and helping this population. Evaluation of substance abuse treatment for underprivileged women that accounts for sexual trauma should also be done to determine the most effective method of intervention.